Hello everybody, this is Dr. Michael Shear from Learn Locator, a free resource on how to treatment plan, utilize, and maintain locator attachments for implant overdentures. The purpose of today's webinar is to describe an exciting new product from Zest Anchors called CHAIRSIDE. CHAIRSIDE is an attachment processing material that has been specifically formulated for locator attachments. As you can see here, what's exciting about this product is that there is no primer required. It has really excellent handling characteristics, and it will bond to itself. So that ultimately will result in reduced material cost per case, and it's also offering a true dual cure, either with a self or accelerated with a light curing unit. It's odorless and tasteless, it has low curing temperature for patient comfort, and it comes with everything that you need in this little product packaging. So what we're going to be doing today is we're going to be utilizing CHAIRSIDE to attach this complete denture to these two locator attachments. For right now, I'm going to set aside this model with this denture and describe the product packaging that CHAIRSIDE comes with. As you can see here, it's a long rectangular box that if we were to turn it around, there's different pictures and information listed on the side. First and foremost, there is a lot and reference number in case that you want to reference this in your chart notes. Additionally, there is an expiration date. As we flip to the other side, we can see here that it will pictorially represent everything that comes inside of this box. The syringe and plunger containing the CHAIRSIDE pickup material, mixing tips, and angle tips, to which you receive 15 of each of them. As we open up the packaging from the side, we can see inside that it comes with a standard instruction manual that we'll describe in just a moment, the syringe containing the CHAIRSIDE product material, two baggies, first and foremost the the standard auto mix mixing tips, and the angled mixing tips. What you'll also notice inside the processing packaging is that there's this little orange card. This orange card will indicate a note just saying that you should be expressing a small amount of this material prior to using with the auto mixing tip. This is fairly standard for most products that come packaged this way. What happens through the manufacturing process as well as the shipping process is you might get a little bit of settling of the material within these little cartridges. Expressing a small amount on a pad prior to use ensures that you get adequate mixing and full complete mixing of the two materials. So as I mentioned before, what's exciting about this product is how it is packaged, as well as the fact that you don't see any primer needed. Zest has formulated this product so that way it can attach a locator housing to a complete denture without the use of a varnish. Also, it comes with this small auto mix tip and an angle tip, which is really exciting because the handling characteristics in conjunction with this angle tip really make it very unique for processing these attachments. So as we see here, if we put the product aside, we can see our complete denture is now sitting on top of our tissues. The first step in any sort of procedure for attaching a locator overdenture housing to a complete denture is to ensure that we have enough clearance around the denture to the locator attachments. So I've already created a small amount of room. The first way to do this, as you remove the locators or attach the locator attachments to a new set of implants, either through a healing abutment or a cover screw, the first thing you want to do is create some initial room. And this can be done with a fast-acting bite registration PVS, such as Blue Moose. Injecting into the intaglio surface, you can press it right on the locator attachments just to give you an idea of where they need to be, clearing a little bit of room. So at this time, now what we can do is just take our patient simulated model, and I'm going to be describing the steps involved with attaching this denture to this patient model. So step number one is to utilize this little O-ring spacer. The O-ring spacer is going to be fit just very lightly on top of the locator attachment, in addition to the other side. As we take the locator denture cap, we can see here it has the little black processing nail already in there. We're going to be taking that to the mouth and very lightly holding from one corner, attaching to the other side. Sometimes that'll pop out on us. As you can see here, as I do that, I'm going to zoom in just a second so you can see. And as you do that, you can see that it compresses this little O-ring spacer, so that way it prevents any sort of undercut formation. As we utilize the chairside material to pick up this denture housing cap, it's going to prevent any sort of material from coming up underneath the implant, the attachment, or more importantly, the housing unit. Next step is we take the next cap and attach it to the implant. Now as you notice here, this side compresses a little bit more, and we have just a little bit more height of this attachment. You can see a little bit of that nitide coating showing through. What we can do with these O-ring spacers is I can stack them on top of each other. So I'm going to remove the denture housing cap. And take one additional O-ring spacer and apply it to the top. Take that denture housing cap and attach it to the implant just like that. Now, as you see here, that stackable capability is really unique with the locator attachment. Let me zoom back out for a moment so you can see the entire picture. There we go. So at this point, we now have the denture caps installed on the locator attachment. If we were to take that complete denture and visualize that we have a hole recess around there, I'm going to be verifying that the denture is sitting on top of the implants correctly. The most important step is to just take your fingers and feel and ensure that you don't have a denture rock around here, which I have a small rocking motion around the complete denture. So, initially we used a bite registration material to verify that we have the locator attachments around the initial place that where we need it to be. If we were to try to do the same thing with that material right now, it would actually rigidly lock around these locator attachments, and you would have issues with that binding on the denture housing cap, or it would be a little bit messy. There's several different ways to evaluate the area that it is binding within this complete denture. My preferred way is just to use a white fit checking type material. And this is a base and a catalyst formation. You can mix it together and apply it on the inside of the denture. I've heard many different ways of doing it, including utilizing just rope wax inside of the housing recesses, pressing it onto the complete denture and making a mark. Articulating paper on the inside of the complete denture and setting it into place. I've also heard of occlusal indicating wax, and these are just little green strips that if you were to open up the box, they come packaged like this. You can put this on the intaglio surface of the complete denture and achieve the same result. And finally, another way of doing it is just to use a light-bodied PVS material on the inside of the complete denture. So my two favorite ways of doing this is either with the fit checking material or with the white wax. I've tried pretty much every different way of attaching locator attachment housings as well as creating the recess spaces. And I found that this tends to be the cleanest as well as the cheapest. That being said, you do have to be worried about a little bit of waxy residue left around the locator housing. So in essence, a lot of times I like to use this silicone material, and then again, this is silicone fit checking material that you can use on crown and bridge. It comes in different colors as well. The white is preferable because most dentures are pink on the intaglio surface. Now, a lot of us are familiar with the processing package that comes with each of the locator housing attachments. Inside of the processing package, you can see that it has everything that you would need to attach to the denture to the implant locator attachment. We have the housing with the black processing male, the O-ring spacer, which we have already seen, and then 3 different levels of retention. The levels of retention go from blue, which is the lightest, pink, which is the medium, and clear, which is the heaviest. In a processing package, it usually comes with 2 of those because most of the time we're attaching 2 implants to the complete denture. Now that we have our O-ring spacers as well as our black processing males inside of our denture housings, we're ready to begin to verify that I have enough space around my complete denture. So So what I'm going to do is I'm going to describe one way of using this white indicating or the white rope wax on one of the surfaces, and then I'm going to use the silicone material on the other. If you take that, just express it right down inside of that housing. And I push on it just a little bit with a little bit of wax, just a spatula. And now what I can do is I can seat it directly onto my housing and verify the area that it's binding. As you can see here, the area that it was binding was just on the occlusal surface or on the surface that is on the superior border of where this is right in here. It pulled away from there. So what I'm going to do at this point is just take a blue pencil and just make a mark right in there. The only caveat to this technique is it does tend to be a little bit messier. So what I like to do is go ahead and utilize either this mixing spatula, and I can remove this, or we can just go ahead and utilize like a 7 spatula that you would use for denture waxing. So now that I've removed most of the wax, I can go ahead and take the rest off with a burr or with a steaming unit. I'm going to go ahead and utilize the fit checking material on the other housing. As you see here, I have a base and a catalyst mixed out, way more than I probably need for this task, so I'm going to cut it up by half, and it looks like I'm going to use most of it just because this is a small mixing pad. And I'm going to apply it to my recess. And seating it and holding with light yet firm hand pressure. I like to hold this with my fingers through the entire process, and then once it initially starts to set up, I don't mind if the patient just bites down lightly like on some cotton rolls just to hold it down in place. What you'll find is here on the bench top, this will take a few extra minutes, where in the mouth it generally takes about a minute, minute and a half. So we're going to take a break. We'll cut back to when it's all done. Okay, so it's been a few minutes since we applied the fit checking material. We can go ahead and now check to see if that the material is fully polymerized. So I'm going to go ahead and back in the mouth and remove the complete denture. Sometimes it takes a little bit extra force, and now sometimes it does get stuck to the actual implant attachment. And this is perfectly fine because it'll allow us to visualize exactly where I have some of the binding. And this is something that very commonly happens inside of the mouth. What I tend to do is verify this area where I see some of the attachment, the denture cap showing through, and then translate that into where I see it on the intaglio surface of the complete denture, right where the recess is. And we can see that's going to be right around in there. And we mark it with a red blue pencil. Now sometimes what I try to do is I try to go ahead and very carefully tease this from the mouth. And if it comes off cleanly, we can then try to attach it into the complete denture. A lot of times that doesn't happen. It will happen a lot cleaner in the mouth than it will on this little model. And unfortunately, because we're working off this little pink model, that has now attached to the model fairly well. And occasionally it will also bind to this little block out spacer, and I can retrieve that from the inside portion of that. There we go. And these two will not bond to each other, as you see here. It comes off pretty cleanly. Just kind of roll it around a little bit. And that'll clean up. Now if it does come off like that with the material, it is important to go ahead and pop off the housing cap, reattach the O-ring spacer so that way it just fits on this little notch on the locator attachment, and the housing goes back in. And now at this point I can go ahead and take a handpiece and relieve those two areas. Just to review, I have some high spots right in here, as well as on the wax side right in here. My preferred burr for utilizing for relieving those internal areas is this kind of like inverted cone bud-shaped burr, a larger size. What I do is just come in here and just relieve this internal portion that you see here, and then also in here. What I like about these burrs is that they're fairly well sized for the actual denture processing cap, as you can see here. It does create some sort of undercut and recess, just minor, but more importantly is it doesn't cut equally from the top and the bottom like would you expect from a barrel type acrylic burr. This tends to be a more conservative approach to relieving the internal surface of the complete denture. Now at this point I can verify that I have relief and try it back on my patient model. As we see here, I no longer have any rocking and very little minor rocking, which is probably just attributable to the model, but on this side and on this side and on this side, zero rocking. I'm going to go ahead and spray a little bit just to clean up my bench. There we go. Okay, so now at this point I have verified that I have enough clearance surrounding my locator cap, my denture cap. If you do feel like you've got a plastic on metal type contact and it feels dut, 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 or if I pull it sideways to sideways, sideways to sideways, that means you need to relieve more. What you'll notice is that I insert and remove this complete denture. I might feel a little bit of resistance as it goes into place. That happens to be okay. If we have a little bit of metal contact as you're inserting and removing, it's not as critical as once it's in the mouth and you feel side to side if you have any movement, if you feel like you have any metal on acrylic contact. Because it is normal. When you insert and remove, there could be slight divergency between these two implants, and the path of placement might just bump one and then fully settle into the other. So I'm going to go ahead and remove both of these denture housing caps, because I have a little bit of wax on this one, and possibly a little bit of silicone stuck on this one. And these two O-rings, and that O-ring. I'm going to go to the laboratory and just clean them up a little bit with just some alcohol or potentially a steamer, or you can additionally use just a 2x2 piece of gauze. We'll be right back and I'm going to proceed to the next step. And now once we've cleaned up our denture caps, either with just a 2x2 or with a steaming unit if you have available, you're ready to go ahead and reattach everything to the locator attachments. Step one is to go ahead and take our O-ring spacers and reapply those. Similar to how we had before. And then the housings. Now at this point we're going to go ahead and just verify one more time that we don't have any rocking motion of the complete denture, as we see right here. Now it took a little extra work for me to go ahead and clean up the housing cap that I used, or the denture cap that I used with the rope wax. This just happens to be one extra step that we have to do, and is preferable by clinicians that have a steaming unit within their office. If you don't have a steaming unit within your office, I would recommend not using the wax technique, as it can be a little bit messier. Again, I prefer the fit checker material, or the light body PVS is a very nice alternative to that as well. However, it's a little bit more difficult to use. Once the denture caps have been reapplied to the locator attachments, we're ready to begin going ahead and creating our mechanical undercuts within this complete denture, as well as the relief holes. So I'm going to set aside my simulated patient for now and switch over to another burr, which is an inverted cone burr. And I'm going to zoom in a little bit so you have the opportunity to see this in close. The inverted cone burr creates a mechanical undercut that best serves for this material. It is a recommendation from the manufacturer to provide mechanical undercuts for the chairside material as well. So what I'm going to do is I'm going to take this inverted cone and just run around the sides of the complete denture relief hole. Staying away from thinner areas like on the facial, I create a mechanical undercut, like that. And then same thing over here, along the sides. And along the sides. Again, staying away from thinner areas, especially on the facial. Now at this point, you might have a little bit of dust surrounding your complete denture or your bench top. Let's clean it off for a second. Again, my trusty little 7 spatula, I can get in here and just kind of wipe it away. Or wipe it away. One additional way of cleaning this up is just to use an alcohol-soaked cotton tip applicator or a 2x2. Certainly a little bit of air goes a long way as well. Now at this point I'm going to switch over from my inverted cone burr to my number 8 round burr. My number 8 round burr is going to allow me to create relief vent holes within the lingual surface of the complete denture. This is an optional step that some clinicians don't feel comfortable with, however I highly recommend it, because hydraulic pressures of when I put this material inside of these relief vents or these relief chambers, it will create a pressure material that will sometimes express onto the alveolar ridge. We try not to get any of this attachment material onto the actual tissue-bearing surface of this complete denture, because once we have that happen, we try to remove a little bit, and then guess what? There's a little bit of a void that happens to be in that tissue area. So a relief vent will actually permit this material to flow out towards the lingual, which will, in essence, create a more ideal situation for the complete denture attachment processing procedure. So what I'm going to do is I'm going to hold the denture at an angle, and I'm going to shoot for right at the top portion of where my locator housing is going to be, or the denture cap, and I'm going to drill until I pop through to the lingual surface, just like so. As you can see here, it creates a hole on the lingual slope, and I can clean up that hole a little bit by coming back down through that direction, and as you see here, I've got a really nice vent hole. Same thing on this side. Aiming at right where that junction of these two walls are, holding my complete denture steady. And now I've just successfully created vent holes, as we see right here and right here. A lot of clinicians don't feel comfortable with this technique because they sometimes feel that patients will feel like this is a strange modification to their complete denture and not aesthetically pleasing. However, in my experience, and the experience of many, many clinicians that I've had the opportunity to interact with at these CE courses or throughout the country, very few clinicians have experienced a patient that says, no, I just don't like that aesthetic appearance. Now sometimes there are some other techniques where you can punch a hole from the facial and then also one in the lingual and flow material from the facial surface to the lingual slope while the denture is on top of the tissue. And I can see they're having a slight aesthetic concern with that, especially if the patient has a high smile line and maxillary cases, or for those older patients on the mandible that might show a little bit more mandibular teeth. So now at this point, we can clean off any sort of residual dust that we have in here, again with my trusty number 7 spatula. As we see here, and with air. Now at this point we've finished all of the mechanical preparation for the chairside material. As we assemble the syringe with the auto mix tip, it'll connect with a notch that lines up to this notch. Now before we do that, remembering that little orange card that we had previously described, we're going to go ahead and express a small amount of this chairside material onto a mixing pad just to clear out some shipping, settling, or processing settling. At this point, we're going to line up the notch tip with the notch tip, as you see here, and we're going to twist it until it locks into place. Now what you'll find is that some of the marketing materials will indicate that the angle tip is to be utilized for attachment procedures from step 1. And now this is a clinician preference that's totally up to you as you learn how to utilize the chairside material. As I've utilized it more with patients, what I found is that this little mixing tip is really effective by itself. The angle tip is best utilized at the end for filling in any sort of voids. However, if you feel more comfortable, you can attach this very easily to the top of the mixing tip and inject this material, just like so, into the complete denture to pick it up. I'm going to demonstrate the earlier technique, which is just utilizing this mixing tip, as you see like right here, and injecting it into the relief holes that we have prepared in the complete denture. So at this point, I'm going to go ahead and take my patient model. And again, what you'll notice is verifying that I have my relief holes and the denture does not rock. It's an optional step that you don't need to do. We're now ready to begin the attachment procedure. There's some clinicians out there that also wish to further treat the surfaces of these denture caps. That's also an optional procedure that I have not really found any sort of huge need to do. Some people like to micro etch them just with sandblasting, or they'll put a notch on the side, or do various clinical techniques too. I personally don't find that exceptionally useful. However, if you feel desire to do that, certainly a little bit extra mechanical retention won't hurt you. Now at this point, we're ready to begin the actual processing pickup material with the chairside product. Step one, again, we've already verified that the denture fits into proper place. What we're ready to do now is go ahead and with an intraoral air tip, just dry off the attachments, ensuring that they're very, very dry. At this point, our patient is in a relaxed position, not a strained muscular position, because as we insert the denture, we want it to sit passively on the alveolar ridges, and complete tissue adaptation is really, really critical. At this point, we're ready to begin injecting the chairside material inside of our denture recesses. So once we do that, we're going to go ahead and also reapply it to this complete denture analog. Since this is a model, what I'm also going to do is take one extra special precaution, just put a little bit of Vaseline or petroleum product onto this surface, so that way I don't get a bond of this material to my model. Now, obviously, in a clinical situation, this is not something that we would do. However, I have found a lot of success in placing a petroleum jelly on the intaglio surface of the complete denture, surrounding where the denture pickup material is going to be. And I'm going to do that as a demonstration here for you. Taking our complete denture in the areas surrounding where my locator attachments are, I'm just going to be placing a little bit of this petroleum. Being careful not to place any inside of the actual housing recess. As we see here, and as we see here on the outside, and then a little bit on the outside over here as well. Also being careful not to get into our vent holes. Okay, so now as we take the chairside material, I'm going to be zooming out just a second so you can see us picking this up very nicely. The chairside material, you're going to be grabbing it from with your thumb at the tip of this and an index finger and middle finger in a normal syringe type position. As I inject, I'm going to be ejecting approximately until it's 2/3 full. There we go. And there we go. As you see here, it has superior handling characteristics. It's not slumpy nor runny, and is perfect for locator attachments. Some people like to go ahead and take the chairside material and apply it directly to the top of the locator denture cap. I'm going to do that for one side and not for the other. My preferred technique is to not do this. As I'm ready to go ahead and place my denture on top of the locator attachments, I'm going to zoom back in. So that way you can see how this material is going to compress. Here we go. Nice and easy, gentle pressure. And verifying that I've got denture material, chairside material expressing out those lingual vent holes. Now at this point, I'm going to have a very light hand pressure. So ensuring that I have complete tissue adaptation completely surrounding that complete denture and the attachments, but I don't want heavy pressure on the actual tissue. Because if we think about it, if I'm just lightly hand holding, it's going to ensure that the denture is adequately adapted to the soft tissue completely around the attachments. If I have the patient or instruct the patient to bite down firmly or even gently, many times patients will bite down a little bit crooked in different areas. And this can be a concern because as the patient bites down a little bit firmer on one side than the other, it's going to lift the denture base just ever so slightly on one side as compared to the other. So my preferred technique is to just hand hold the entire time. During the first initial minute or so, I finger pressure myself and then I'll switch off to a dental assistant. As I mentioned before, what's exciting about this product is it is a true dual cure. So I can take a curing light and approximately 15-20 seconds on the facial and lingual, and you'll be ready to remove. And this is a task also that's wonderful to have your dental assistant handy because I would want to keep pressure on both sides as I'm doing that. And then finally from the lingual slope where you have your vent holes. Putting my curing light aside, I can just take my finger and just verify that I've got complete polymerization of this material from the lingual. And then just looking at it from the sides, I don't have any material expressing out. I'm going to be very careful in removing the attachments and verifying that I have complete tissue or attachment pickup. As you see here, it's only been approximately a minute to a minute and 15 seconds. I've accelerated the material set time by utilizing a curing light with the CHAIRSIDE product. And this is really an exciting material, an exciting feature of this material because all of the other materials on the market will tell you that yes, a light cure will help, it will accelerate your cure, but all it really does is put heat into the actual denture. Since this material is essentially like a composite resin, the curing light will cure this material, accelerating the set time and making it ultimately faster for you in your chairside pickup. So being faster with this procedure also ensures that you'll have greater clinical success because the longer that this stays in the patient's mouth, there's a greater chance that he or she might bump the denture or move the tongue around side to side. So if we can minimize the amount of time that this is in the mouth, the better. At this point, the first step in any sort of pickup is to verify that I have all my O-ring spacers out, which my assistants are really well trained to do so. As you see here, pull that one out. And then the other two also I flicked off to the side just during the procedure. So as soon as this comes out of the mouth, my assistant is trained to grab those little block out spacers, verifying that the patient doesn't swallow or aspirate them. As you see here, I have minimal material that is expressed out to the sides. Very, very small. I have like a tiny, tiny little bit right in here, and then none over here, and then just a tiny, tiny bit right over here as well. So once I've removed this from the mouth, the first step is to go ahead and start just doing some light trimming right around where the attachment is. And my preferred burr to do that is either a number 8 round burr or a smaller bud burr. I'm going to go ahead and use the number 8 round burr and show you my clinical technique that I prefer to use for trimming around the actual locator housings. So now at this point, what I can do is just take my burr at a moderate speed and trim a little bit here. And it's okay to rub that little black attachment at the top, but I don't want to actually contact the actual metal portion of the locator. Same thing here on this side. It's okay to bump the superior surface of that locator attachment. And there we go. Cleaning it off with an air. As you see here, now I've got my black processing nails in clear view, as very little flash has been expressed over the edges. One thing I do like to do at this point is I like to use either a cleoid discoid instrument or just a carver type instrument just from the sides, just to flake off any sort of excess material prior to removing the actual black processing males. As you see here, I might have a little tiny bit of flash material right over in here, and we'll be addressing that in just a moment with a different burr. As I switch out from that number 8 round burr, I do like to switch over to this little tiny bud-like shaped burr or inverted cone. And this is perfect for adjusting little areas of flash, like you see in here. And that just flakes right off. And that was the only area of appreciable flash that I had, maybe just like a little tiny bit right in there. Also, what you can do is just lightly mechanically remove some of these areas just with a number 7 spatula or with a cleoid discoid type instrument. Same thing here, cleaning it off. And then using my inverted cone again just for light trimming. So now at this point, what I would do is I would verify if I have any sort of voids or anything that's been formed around the edges of the locator. And let me zoom in just a touch so we can verify that together. Now, unfortunately, I don't have any major voids. But what I'm going to do is I am going to create a small one so that way you can see how the angled tip can fill in those voids. So as I mentioned before, we don't have any voids unfortunately, but let me go ahead and create it. Just a tiny little void. So I have here handy just like a 1/4 round or size 1 round. I'm just going to create this little void. Okay. Now if you look closely, right in this area, I've created a little undercut void right in there, right in there. So I'm going to set my denture down and get it ready to go ahead and utilize the chairside material with the angled tip to fill that void in. I'm going to remove my auto mix tip, place a new one on top of it with my angled tip. Simplest way to do that is just to line up our little notches again, apply our auto mixing tip, and take our angle tip and attach it right onto the chairside syringe. Now at this point, what I can do is take my angle tip with a careful motion just to fill in just that little tiny void, pushing from one side. And that's pretty much it. If I need to, I can take an explorer just to make sure that it's filled in, and then feathering it out. Also, being able to light cure this product makes this task very, very fast and very, very efficient. So we give it a full 20-second cure, and we're ready to go ahead and start trimming the chairside material. Okay, now that it's been fully polymerized, if I take my instrument again, what you'll notice is that I have no movement, and it's been fully polymerized. At this point, again, what I'll do is take my number 8 round burr and just trim some of those edges, verifying that I don't have any sort of contact when that denture is going to snap into place. Okay. Now it's an excellent time to go ahead and start taking this material and just verifying that my denture attachment pickup has been completed. If I go back to the patient and reinsert the attachment, we'll notice that I should be able to hear an audible click and feel very little movement of this attachment. The black processing cap does not have a pivoting cap capability like the normal locator attachment. If you notice that when I take the locator attachment and show you this large model, you can see here that when the denture cap is sitting on the attachment, what is actually moving is the locator housing cap itself, or this denture processing cap. The part that's rigidly attached to the locator attachment is this nylon insert. And if I remove it, which sometimes I can and can't do, there we go. Here's the locator attachment, and then here's the simulated nylon insert. When that inserts, it'll snap into place, and then that portion, the nylon insert, fits rigidly to the locator attachment. The black processing cap, however, does not have this pivoting capability. So when you have the denture in the mouth after picking up this material with the chair side, you should notice no movement at all. And that generally indicates that you have picked you have done your procedure correctly and have attached this denture correctly to your locator attachments. Pulling carefully, you should also notice that you should have some click and some sort of retention. So I'm going to pull it out again, and that's the noise you want to hear. And you can instruct the patient at this point, okay, we're just doing a test right now. Don't worry, I'm going to polish up these two little bumps right in here, because it's really important before you invest all the time in polishing this denture up that you verify that you've picked up everything correctly. So now at this point, what I like to do is go ahead and polish up the external portion of my complete denture. And the best burr to do that is just 2 burrs. A standard pear-shaped acrylic burr or tapering acrylic burr with one of these polishing points that's available. And these are just denture polishing points. They have this little impregnated cone-like device that polishes as well as cuts at the same time. So the first step is to go ahead and take my tapering acrylic burr and just hold my denture very carefully. And since I Vaseline nicely on the exterior surface of my complete denture, it should just peel off nice and quickly, as you see right there. Same thing to the other side. See how nice that comes off there? Okay, and we can take air and clean it off. So now at this point, we can also take that little impregnated point that I was showing you before and just polish up some of those edges and get an initial smoothing. Ready to clean it off. And now I can verify that I'm pretty much smooth, everything is exactly what I like, and this is the final step right before we polish onto the pumice. Before we go and take our denture to the pumice rag wheel, I'm going to go ahead and utilize my core tool and remove my black processing inserts and verifying that I don't have any flash of the chair side filling in over those attachments. So the first step is I unscrew the top portion of my core tool about 3/4 of the way until you notice that plunger. Let me zoom out a little bit so everybody can see. That plunger can fall up and down as I flip the core tool. Let me try it from this angle so you can see. There we go, and it's going to fall there. And what's going to happen is as you take the vertical motion towards your black processing cap and insert straight vertically and pull back straight vertically, it's very easy to remove your black processing mail. As you tighten this, this is going to go clockwise, this is going to go counterclockwise. It should just pop right off, just like so. Unscrewing again, inserting into the other side. vertically, pulling vertically, and it pops right off. Nice, clean, and easy. And again, until it falls off. And now this is really a pretty crucial spot, because now I've finished my denture attachment procedure using the CHAIRSIDE product. I'm just going to take an instrument to verify that I don't have any flash-like material hanging over the edge or over in here. Because at this point I can take my round burr and just touch up a little bit, like I see like one little spot right in there, or my butt-shaped burr. And for this one I'm going to go ahead and use my round burr. I have a touch of flash right in there, and being careful not to ding the metal portion of my actual locator cap. A little bit of air. And now again, the same thing, I can take my trusty number 7 spatula and just clean off any sort of excess that I have along in here or along in here. And if you prefer to use a discoid or a cleared instrument or a carver-like device, this is perfectly fine as well. And I'm just going to simulate that here as well. Okay, so this is the final appearance prior to polishing. I like to go ahead and polish first before I put on the actual blue or the pink insert, just to verify that I don't get any polish or any sort of pumice up underneath these attachments. So I'll be right back after I polish. Okay, so we're back now. I've gone ahead and I've taken my denture and run it under a rag wheel with medium pumice. You can also use fine pumice, flour pumice, whichever you're liking, but as you can see here, I get a really nice high shine on that lingual slope of that complete denture. The tongue finds this very comfortable, very compatible, and you can see here, as I zoom in, that the CHAIRSIDE material polishes up to a beautiful shine as well. And on the intaglio surface, the CHAIRSIDE material blends in very nicely to the complete denture. Coloration of the material fits in very, very nicely with most pink acrylic resins. If you have a patient with more of an ethnic shade as well, it's just simple to inform them that you will notice a little bit of pinkish color surrounding your kind of darker color denture. And most patients that I have made dentures with more of an ethnic resin have not complained about this at all. So now at this point we can go ahead and take our complete denture and our patient model, or our patient, and we're ready to go ahead and attach the insert of choice that you would like to utilize for this patient. For most patients, I like to utilize the blue initial attachment. This is the lightest attachment with the standard range. The red extended range is a lighter attachment than the blue one, and in situations that might be more applicable, but for most patients I have found success utilizing the blue attachment. Alternatively, if you have a patient with high retention demands or needs, you can immediately go to the pink insert. What I find clinically with my own experience is that I like to start with the blue because the least amount of retention that does the job is what you should be using. I'm going to take my core tool, remove the top portion, and this is going to be the insert assembly for where I'm going to put my blue attachment on. Now you notice that this will tend to fall. There is no sort of retention mechanism in here, so this is something that I would recommend not doing, obviously, right in the patient's mouth. As I take the complete denture, I'm going to support it from the occlusal surface, and I'm going to carefully insert vertically until I hear a loud snap motion. If you don't hear that snapping motion, it doesn't mean you inserted it incorrectly. It just means it went in a little bit askew. If that's the case, just take your instrument and allow it to pivot back in there so that way you get full adaptation of the nylon insert to the housing. And repeat with the other side. Okay. And there's the finished final product. And then the moment of truth, as you take it back to your patient and verify that you have a nice retentive sound, you might notice a little bit of movement, and that is normal because these denture caps are meant to pivot. So what I like to do at this point is just verify with the patient if this is sufficient retention for them. If it's not, I'll go ahead and remove the blue attachment and replace it with a salmon or with the pink colored. So I'm going to demonstrate that here now. Again, I'm going to unscrew my core tool until it's about half to 3/4 of the way down. Push vertically, pull out vertically, and the attachment comes out cleanly. And if I'm careful with it and hold my finger on one side, as I screw it back down into place, it allows me to utilize, or allows me to remove the insert without damaging it. And I could reuse this in that same patient if I so needed to. At this point, again, unscrewing here and replacing with the pink connection. And now we have half completed. I'm going to repeat with the other side. I'm being very careful. Carefully remove that. And then inserting my pink. Just like so. And this would be a step up if the patient felt like their retention was not sufficient, ensuring that I have complete retention needs with the patient. And this patient seemed to be more satisfied using the pink one, although most of the time my patients are very satisfied with the blue one. At this point, to verify retention, what I like to do is just take my thumb up underneath the corners of it, verifying that it is retentive. I like to take my fingers and hold from different positions, alternating pressure, facial, on the incisal ledge, as well as with the molar, verifying that I have a little bit of movement, but not an extreme amount of movement. I then ask the patient to stick their tongue out, to see if they can dislodge their complete denture. And then also I'll take cotton rolls and have the patient bite down. And sometimes what I'll do is I'll even take my finger and hold it in there, ask them to bite on my finger to verify that this side is not going to dislodge, because tactile capability is going to be your best. Now at this point we can remove and verify that we have completed the procedure. So now this is the termination of this webinar. As you can see here, we have successfully attached the locator housing caps to our locator patient, 2 implants. And we've successfully utilized that with our chairside material from Zest Anchors. As I mentioned before, what's really exciting about this product is a couple of things. Number one, it's just so easy to use. It's really a game changer. Number two, it's so easy to use because there's no primers necessary. As you noticed, I have an excellent attachment to this complete denture without the use of sticky varnishes or bonding agents or smelly materials. And the less smelly that you can have for your patients, the better. What's also great is the handling characteristics and the fact that it will bond to itself, as I demonstrated with using this angled tip. Ultimately, sometimes people will think the best feature is that handling characteristic because of the no slumping nature. It's easy to add to any sort of voids. But what I find is a really exciting feature is the fact that you can go ahead and use a light curing unit to truly accelerate and cure the product. So as you notice here, I didn't have to wait the 4 minutes, 5 minutes that some other products will advocate. No, I waited 1 minute, 15 seconds, 1 minute and 20, and ultimately I had a really good cure of this product. It's odorless and tasteless, and there's low curing temperature for your patient's comfort. This mixing tip is also shortened so that way you can utilize this material more often. This material is an 8-gram tube. Typically it gets about 15 uses per 2 implant overdenture case. So pricing will be released from Zest Anchors, and that will be available on the Zest Anchors website as well. And it comes with everything that you see here, including the syringe with the material, 15 of the auto mix tips, 15 of the angled tips. And the reason why that you have to be a little bit careful as well with the number of uses per syringe tip is that if you do have an excessive amount of times where you have to fill in voids, you might have to order additional mixing tips or angle tips to suffice for your mixing product. But 8 grams is about sufficient for 15 cases of 2 implant overdentures. So that being said, this is Dr. Michael Scheer with the Learn Locator, a free resource for how to utilize treatment plan, utilize and maintain locator attachments for overdentures. This is a webinar describing the CHAIRSIDE material from Zest Anchors. Again, a very exciting product, and I encourage you to go ahead and give it a try yourselves. Thank you so much, and we'll chat next time. Bye-bye.